Happy Wellness Wednesdays. How is everyone today? I have, because you wanted it, I have Dr. Keith Berkowitz on with us today, and we're going to talk about reactive hypoglycemia. And you know, a lot of people don't really understand what that is, and we're going to explain it to you, and it's affecting a lot of people, and including myself. So I am really excited to have Keith with us today. He is with us from New York, which I believe I hear is a sunny day over there.
Yes, beautiful. So,
I hear you're having California weather.
yes. Would you like to come back to New York?
I'll stick around here for a bit longer. I'm waiting for you to come visit me. How are you?
Good, good. Thanks. My favorite topic in the world, which is awesome.
This is like totally, you talk about this all day, every time I talk to you. And it's important to talk about. And a lot of listeners today are going to be very interested in this particular topic. We're talking about reactive hypoglycemia. Keith, that sounds like something out of a
Science fiction novel?
Yeah, exactly. I mean, of course we understand it, but I love the way you explain it in layman's terms.
So we use the term hypoglycemia. Hypoglycemia really means low blood sugar. And so what reactive hypoglycemia means in response to, it's a stress reaction to. That could either be high cortisol from stress, we talked a lot about that last week, or it could be from glucose or food. So what happens is people will have food, their sugar will rise, but then it will drop. And it's that drop that causes a lot of the symptoms.
And that drop is like 4 hours after eating. It's not right away.
Right. And what's interesting, I like the analogy, it's like going to a gas station, filling up your car with gas, but there's a hole in the bottom.
There's a hole in the bottom. Yeah, exactly. And so you eat something, and then, you know, the other thing that I get from people is they eat something and they don't feel satisfied. So they reach for something like a dessert after, because that's going to sort of nail in the coffin is having that dessert after you've eaten a meal.
Think of the worst punishment. You eat, but it gave you no value. So you ate all these calories, but you're still hungry, or you're not feeling good, or you're fatigued.
Even worse, people get quite like dizziness, as though they haven't even, exactly what you said, they haven't even eaten anything. And I see this a lot in patients. Keith, how many patients would you say, how many people do you think have this?
So there were some studies looking at something called carbohydrate intolerance.
Right.
And that means the inability to tolerate carbohydrates. And remember, we always talk about carbohydrates becoming glucose. That's upwards of 60+%. Mm-hmm. Last week, we talked about underactive thyroid. I think almost every underactive thyroid patient I do see also has reactive hypoglycemia as well.
100%. 100%. And why do you think, you know, you're in the conventional medical field, you know, why aren't your people on your people? Well, my people talk to your people. Well, or you talk to your people. Why isn't anybody doing anything about this? Like, why is this so undervalued?
So I think for two reasons. Number one, you know, we always talk about high blood sugar. Everyone's focused on diabetes or pre-diabetes. And the other two, there's really not guidelines out there for what is the definition of hypoglycemia. And when people do blood work, and I think this is the biggest reason, you come to the doctor fasting, right? So you get your fasting glucose, you get your fasting insulin. But this is a stress reaction. This is a reaction to something. So you have to have that stressor, then check the blood tests, be able to get that result. So it's often missed for that reason.
Why don't we tell everybody some of the symptoms so anyone that's listening can actually write this down and be aware? Why don't we give them some of the symptoms, Keith?
So one of the main symptoms is fatigue. The other ones could be things like palpitations. What's interesting about palpitations, it's palpitations at rest. Right. Not palpitations with exertion. Whenever we think of palpitations with exertion, we think of a cardiac or heart issue. Yes. When we think of palpitations at rest, that can often be low blood sugar. And what people don't realize is that low blood sugar is actually a panic state. People can have high blood sugar and not feel any symptoms, but they always feel symptoms of low blood sugar. Irritability is another one. My favorite one, hangry.
Hangry, yes. Who's had hangry before?
So sweating, excessive urination, lack of sleep, it's often the cause of when people don't know what's going on and they don't feel good.
Right. So anyone that's sitting at home and listening to this, if you're at rest and your heart, you have heart racing, that's what we call heart palpitations, where you feel like your heart's boom, 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 boom. You have fatigue, you have sweating, any of those symptoms, this might be something that you could be experiencing.
Yeah, and again, it's much more common than people think. I mean, 60% is a pretty large percent of the population. What people don't understand about it, it really is a pre-diabetic condition. And that's what confuses people, that it does increase that risk later on of diabetes. And also, this is often seen among people who are not overweight. Traditionally, we always think of diabetes as being a weight issue. That's not necessarily true anymore. Often people will have, I call it unstable blood sugar, and be thin.
Yes. I have a lot of like I have one particular case you and I talked about before. She's very thin. She has the heart palpitations. She has the sweating, fatigue. And you measure the blood sugar after and it's completely, either through the roof or it's dropped. There's massive, also the other thing is massive fluctuations in blood sugar when you measure it in the blood.
So interesting. They did actually study years ago, even from a mental health perspective. And they thought that a lot of people with anxiety or depression can be caused by this. I have a friend of mine who's been had reactive hypoglycemia for years and years, and she actually had basically medication-reduced depression that didn't respond to any medications.
Right.
And she actually underwent elective convulsive therapy. And it turned out her diagnosis was really, severe reactive hypoglycemia. And it took her 30 years to make that diagnosis.
It's incredible, Keith. A lot of people are out there on, medications, antidepressive medications. Oh, I think we lost him. And so anyone that is listening today that, has this or has some of the symptoms, we're going to talk about what you can actually do to support that. Keith, are you coming back? Did we lose you?
Sorry about that. I think I'm affected by overuse of internet in my area.
You've got internetitis. Internetitis. It's an inflammation of the internet. Too much use. So we look at people that have depressive-like symptoms. They go to their medical doctor and they say, look, I have fatigue, I have palpitations, I have sweating. Okay, boom, all the reasons to put you on an antidepressant. They get put on an antidepressant. Placebo is very strong, so it might work initially, give them some reactions, but might work, but then has a plateau effect and doesn't work. This is because it's a carbohydrate intolerance, basically. And so this is something I think really important that, we're here to talk about, because we're not going to go the full hour today. It would be great to go right into the grit of it, Keith. And let's talk about, we talked about the symptoms. What can we do to support? What should people be doing to support this if they think they have this? What can they do at home?
So one of the things is, one of the keys is, again, it's what we call an insulin-resistant syndrome. What it means is the body, for that glucose level, is making an inappropriate amount of insulin.
Too much insulin.
Correct. And that excess insulin keeps driving that blood sugar down lower and lower. So one of the ways around it is actually preventing that glucose from rising in the first place. And that's dietary. That's avoiding excessive carbohydrates, avoiding refined sugars, balancing your meal much better. I mean, we always talk about digestion and blood sugar are the foundations of everything. And so what you put into the body does make a difference. Absolutely.
So also things that are going to spike up your sugar really high. So people will juice fruit and drink fruit juice and say, oh, wow, I'm doing something good. I'm having orange juice. I know my mom likes to say that I'm having orange juice. Look, it's so good for me. I said, Mom, that's the worst thing you can do. So I tell people, eat your fruit, juice your vegetables if you want to juice anything. And eating the fruit because it has the fiber component, right? So if you eat an apple because it has the peel on it, it's very important because it's got the fiber. The fiber will allow the sugar to be released more slowly into the body than to have a quick surge of sugar.
So important. And another thing about fiber, I think people don't realize, fiber likes fat. So when fiber is combined with fat, that actually works so much better at stabilizing your blood sugar. Example, avocado, right? People often after eating an avocado will feel full. I also tell people to roast their vegetables with a little bit of oil. So those fiber gets saturated with fat. So when it gets digestion, it's not pulling water out of your digestive tract. And that's having a big effect on that.
Exactly.
And keeping your blood sugar much more stable.
Okay, so one of the things we're going to say, so don't juice fruit, okay? The other thing is eat your fruit with the peels, because the peels give you the fiber. The second is add some good fats, healthy fats to your vegetables, because it's going to help you feel more satiated and keep your blood sugar more stable. Anything else, Keith?
Sure. The other things is about rest. Sleep is so important. Proper sleep allows the body to relax. What people don't understand about reactive hypoglycemia, it's actually an overdrive syndrome. It's the body in overdrive, constantly working to monitor their blood sugar. And what also is, the more you have episodes, the more insulin your body makes, the more inflammation you has. So rest is so critical to modify that cortisol level and keep the body more stable.
Exactly. You know, when we look at right now, a lot of patients I'm speaking to now, I'm sure you're getting the same thing, is people are having trouble sleeping. There's so much going on. There's so much uncertainty still. There's so much stress from every corner. Every single aspect of our lives is being affected. And so people are having a very tough time sleeping. And that in of itself is creating a surge of cortisol at the wrong times. So people, I was talking to patients yesterday, and she has her whole family up at, you know, till midnight, 1, 2 in the morning, because there's no routine. So everybody's just hanging around the house, watching the news, 1 to 2 in the morning, then grabbing a bite, snacking. That is going to mess up the circadian rhythm. It's going to mess up the cortisol. And when cortisol, which is a stress hormone, goes up, it's going to cause you to be more craving more, you know, sugars, more carbohydrates. So you're like in this vicious cycle. Stress, crave carbohydrates, high cortisol, messes up insulin, and then you go into that circle all over again. How do we break that cycle, Keith?
Well, again, we go back to structure. So on the thing on the sleep, and I want to bring up another symptom. Often people get vivid dreams and nightmares. That is so a typical manifestation of reactive hypoglycemia. That's a panic state. You should be not remembering vivid dreams and nightmares. So it goes back to proper structure, proper eating, not eating too late. I mean, one of the recommendations we talked about before, taking a walk after dinner to allow that body to cool down and to rest. And obviously not going to bed too late. So which is important. And getting good, you know, sleep is good, but it's quality sleep that's better.
Right. And it's, you know, people that are waking up in the middle of the night to urinate, that's also another sign of reactive hypoglycemia. Again, so these are all, like, write them down and make a list of when you change your diet, tick off from the list that, okay, that's gone, because it will make you feel a lot better. It'll make you in the driver's seat and part of your own healing.
Remember, we talked about hormonal symptoms too, right? Oftentimes, hot flashes and night sweats can also be made worse by hypoglycemia. That's your stress reaction too, and that can often happen. People have night sweats at night or hot flashes even during the day. That's
true. And the sugar and the hormones work hand in hand, and the insulin. So it's super, super important to note down the symptoms. Now, we are looking at, you know, how, does anybody have any questions? Because we're going to have a question and answer period. There are certain vitamins that you can take as well, in addition to diet. So we said fiber, we said sleep. Also, water is super important. A lot of us are super dehydrated. The reason why people are craving sweet things is because they're actually dehydrated. So again, hydration.
And what's critical about that is what people don't realize, when your blood sugar is low, it causes you to lose fluid. So you'll either lose fluid through sweating, through urination, or even diarrhea can happen from that aspect. So actually, that is really critical, because if the cells don't have enough fluid the cells really cannot regulate blood sugar at all.
Yeah. Agreed. So, so people are probably wondering, what supplements can they take to support this? Because there's so much information out there. And you and I both know supplements.
Can I start with your favorite one?
Yes.
Vitamin D. Right? That's, given this time of year, that's the one we care the most about, right? Vitamin D. So vitamin D plays a major role in what we call insulin sensitivity. What insulin sensitivity means is the body's ability to utilize, and especially cells, insulin. We want the body to use as least amount of insulin as possible, because insulin is an inflammatory marker. More importantly, it's actually also a fat-storing hormone. We don't want more of that. So by actually, without vitamin D, insulin doesn't work properly. Right.
So vitamin D, and I recommend you take vitamin D with K1 and K2. K1 and K2, vitamin K is a fat soluble vitamin, and they come from plant sources. You know, it's interesting, Keith, in the 1920s and 30s, they accidentally discovered vitamin K because people were having more bleeding disorders because they didn't have enough animal protein in them. So we know K2 is from the animal source, and K1 fermented, and K1 is from plants. So super important to get the K1 and K2 because it allows for the vitamin D to go into the bone and increase your, bone absorption. And we find that when people just take vitamin D3, there's increased risk for, potentially calcification. So to be safe with the vitamin D, take K1 and K2, although if you have any sort of clotting issues or, blood clotting issues, you need to talk to your doctor first. But most people are on a good vitamin D with K1 and K2.
And remember, last week you talked about cholesterol medications. Yes. One of the mechanisms they can cause diabetes is actually depletion of K2. So K2 also affects the body's ability to stabilize blood sugar. You used the great term, it's like a concert of all these different things together working.
Yeah, it's a symphony, right?
Perfect. I like that. That's
why you and I are so good together. So the other one is chromium. Chromium is so important. We have so many people deficient in chromium, and actually type 2 diabetes, we see massive deficiencies of chromium when we're testing people. And so you can take a supplement of chromium. I mean, we know that pumpkin seeds, those kinds of things are also rich in those kind of nutrients, but we know that chromium picolinate in and of itself, I've used it clinically, works extremely well when taken with meals.
See, people don't realize that you can't metabolize actually sugar without chromium. So for every 100 grams of sugar, you actually need 100 micrograms of chromium to metabolize that. So it's actually very, very necessary.
And then alpha lipoic acid. It sounds like something out of a space shuttle Galaxia type thing. But alpha lipoic acid, what it does is it sensitizes insulin. So insulin is sometimes not sensitive. It can be quite mean and insensitive. So when you give it some alpha lipoic acid, it sensitizes your insulin to actually work and recognize the food that you've eaten instead of it leaking from the bottom.
It's so important. We talk about insulin. Again, remember, insulin is needed to move glucose into the cell. You have finite stores of insulin. We don't have unlimited stores. So you want to preserve that. And again, when insulin runs out, that's diabetes where people end up taking insulin. And it's very important to protect that early on.
Brilliant. And then my favorite of all, magnesium. I would marry magnesium if magnesium was a man. It's so important for proper glucose utilization. It's important for the mitochondria function, which is the powerhouse of our cell. We also see that people with low tyrosine production are because they're low in magnesium. So, really super important if you have these blood sugar issues, magnesium. I love to take magnesium at night before I go to bed because it really helps me with sleep. It calms my muscles. It calms my mind.
And again, when we deal with reactive hypoglycemia, one of the key points is during the day, your cortisol levels are high, right? That naturally keeps your glucose higher.
Right.
What happens as the day progresses, and I always call this, you sit down on the couch, you can't get back up again.
Yes.
Or watch TV, that drops. And the more that drops, the more symptomatic people become. The worst time is actually between 1 and 4 a.m. That's when your glucose is at the lowest levels. And that's oftentimes, you said before, where people wake up, they get up to urinate. And then cortisol stays low until about 5 or 6 o'clock when we need it to kind of wake up and begin our day. Or now 10, 11 o'clock, like you were saying before, to begin our day and start working.
Exactly. And some people will even wake up in the middle of the night and want to eat something like at 4 o'clock in the morning. And that is, if you're craving something at like 4 o'clock in the morning, you need to eat something, your blood sugar's dropped, that's something to look out for as well.
I have a funny case about that. So I had a patient that came to me for weight loss and was eating perfectly. We couldn't figure out why she wasn't losing weight.
Right.
And she ended up installing cameras in her house. So actually at 4 a.m., she was actually sleepwalking to the refrigerator and didn't even know, and actually eating a ton of sugar. So she's like, I've been perfect all day. And then we realized, great, but at 4 a.m.
Binging emotions. It's a perfect amnesia way to forget what you're doing. I've had patients do that too. That's so interesting. And then my favorite of all, Keith, probiotics. Do you want to take the lead on this?
Sure. Probiotics are really critical. So, we talked about two reasons. Number one, they really are synergistic for digestion, right? You really can't digest food without it. So one of the biggest problems with hypoglycemia is that when you start eating, the body senses glucose. It says, okay, pancreas, start making some insulin. But if that's delayed, then what happens is that insulin gets there too early. Right. And then insulin's getting there too early and crashing your blood sugar. So that's the group that actually within a short time actually feels pretty crappy after they eat. And I always ask people, do you feel worse after a meal? And that's pretty typical. And again, we've learned from our discussions before, things don't happen in isolation. Often when you have blood sugar problems, have thyroid problems, you often have digestive problems. And without probiotics, it's almost impossible to regulate your blood sugar properly.
For sure. And so now we're going to go on to our question and answers. Did we miss anything, Keith? Anything else?
Oh, I wanted to give a fact. So there's an interesting fact. So they talked about, and this is probably about a few years old now. In the 1820s, people consumed on average 46 grams of sugar in 5 days. So basically that's a soda every 5 days. Yikes. Now it's 765 grams every 5 days. That is 130 pounds of sugar a year. It's massive.
That's the average American sugar intake.
And so that is so critical. And two other ones, I have to bring up your other favorite topic, H. pylori.
Yes.
So he'll go back to pylori also can affect glucose and insulin for that same reason that probiotics have an effect.
Absolutely. And you remember all you ladies out there and gentlemen, remember, if you're eating too much sugar, it's going to cause your skin to sag. Remember, sugar causes skin sagging because it causes glycation. It causes your collagen to come down this way. So remember, if you're eating sugar out there and you're drinking those Coca-Colas, I know I've done it before, been down that dusty road. Let's do it together and really work on being mindful about how much sugar we're eating, especially now when we're a bit more stressed. Okay, let's go to
So can I bring two more facts? I apologize.
Yes,
so two more. So number one, what people don't realize with hypoglycemia, it's not the low blood sugar that causes the symptoms. It's the adrenaline response from the low blood sugar that causes symptoms. And we were saying before about hypothyroid, the reason they're so much more susceptible than any other group is they have a lot more trouble converting protein into glucose in the liver. So they can't stabilize that blood sugar as quickly as others can. So that's really critical to manage that. And the other part, you're talking about skin and aging. That's why there's so many studies on the diabetic drug metformin as a longevity agent. Metformin works by increasing insulin sensitivity so that you produce less insulin. It's been really well studied and often used as an anti-aging medication.
Amazing.
And now in coronavirus too. They're actually doing studies on coronavirus and metformin as well.
Yes. But you should speak to your doctor about metformin. Don't jump on the bandwagon of getting that because there are side effects to that, and it may not be right for you.
And actually, with people with very severe reactive hypoglycemia, it actually may be a negative.
It makes them worse. Okay. Are probiotics in any other foods other than yogurt or kombucha? Okay. So you have to remember the stomach is very acidic. So by the time you get those probiotics past your stomach, stomach is acidic from 1.2 about 2. So very acidic. Remember, water is 7 on an acidic scale. So I wouldn't rely on probiotics and yogurt and kombucha to be your probiotic. I would take a probiotic supplement. And you can go to my website, healthydoc.com. I have some information. I've got a probiotic I've made, and I'd be happy to answer your questions to check to see with you if this is for you. What blood test should be done to check thyroid for women over 45? I'll let you, we'll do back and forth with the questions.
So going back to thyroid, we talked about in the past, I would do probably 5 tests. So I would do a thyroid stimulating hormone, which is how much the pituitary signals to the thyroid to make. You would do free T4, which is, and free T3, which are the 2 components which the thyroid makes. And in addition, thyroid antibodies, which is one is called thyroid peroxidase, and the other one's called antithyroid globulin. Perfect.
And also what I would add to that is I would get them to do other things like insulin, fasting insulin, maybe worth it to do that, and your fasting glucose. There's also a test that you can do in addition is a reactive hypoglycemia test, which is not probably people's favorite test, but Keith, do you want to just elaborate on that a little bit?
So obviously that's a glucose tolerance test. So what it is
everybody hates that test.
The reason why it's so important is that, again, it's a reaction too. So oftentimes you'll have either food or glucose drink, and then you'll see within 1, 2, 3, 4 hours what your glucose and insulin level does. And that's pretty diagnostic of hypoglycemia. It's probably the most accurate test for making the diagnosis.
I am treating the H. pylori with colloidal silver protocol, mastic gum. I think that's what she meant, not mystic gum, but I like that word. Do you think that's effective? Yes and no. I think, having a practitioner on it with you just to make sure that there are other botanicals that can be used to treat H. pylori as well. And your environment of your gut has to be really, really good. Your diet has to be really good in order to treat the H. pylori. So super, super important to keep your diet super clean. If you want to follow the plan in my 4-week plan in my book, Reverse the Signs of Aging for the UK, Younger Skin Starts in the Gut for the US, that will help keep whenever you're trying to treat H. pylori with any supplements, you have to keep your diet clean. What kind of magnesium do you recommend, Keith?
So the magnesium would matter on what you're using it for. So it goes from the ones that can be more laxative effect, which is like magnesium citrate. When we're looking at things like heart disease and heart prevention, we'll use magnesium glycinate or magnesium taurate. When we're looking for things like brain function, things like magnesium threonate are actually better absorbed. For people that can't tolerate any of those, I will often use a topical magnesium oil, which they can rub on. And typically for people that get muscle cramps or muscle issues or have a lot of digestive issues where they can't tolerate magnesium, that's a nice option.
Thank you, Butopia London. It's very kind of you. We love doing these lives, and we're going to do them every Wednesday. Just, give us some feedback of if you want us to continue doing this and if you have any other questions. My blood sugar goes into 50s at night. I don't have diabetes, and I have had tests to confirm. Even having a meal before bed sometimes doesn't help. Keith?
So again, remember, this is a reaction too. So the meal can often make it worse. So you really need to look at other components that are related. Things, thyroid, your hormone levels, your digestion. And I always say that I can never pronounce that word in concert, but you say it better than I do. That all these factors work together. And if any stress is there that's not dealt with, that can still impact your blood sugar. And also, one way, when you do measure that glucose at night into your 50s, you also want to measure your insulin level at the same time to see if that insulin is inappropriate. Give you an example. I saw someone the other day, the glucose level was normal, it was 82, and the insulin level was 13. Even though they're both normal, that insulin is so high for that glucose level, and it actually will end up dropping it lower. So in order to look at actually a glucose level 50, most importantly, you want another data point, the glucose before, but you also want to see if there's any conflicting factors that can be having an effect as well.
Exactly. It's all about relatively and having a baseline. What's the best vitamin protocol? I'm taking liposomal vitamin C, but I'm starting Terra Nova quercetin. Is MSM good for asthma? Okay. The best vitamin protocol for asthma. Yes, asthma is really important. Vitamin C is excellent at supporting mast cell stability. You know, there's quercetin is super important. But for asthma, it's a diet thing. So you want to make sure that, number one, that you've taken out dairy for sure. You've taken out gluten, you've taken out sugar. Those are super important to take out of the diet. You know, also nasal rinses as well, because there could be some sinus related stuff. But, you know, again, you're doing the right thing, vitamin C, quercetin, but remember, diet is the foundation. Next question. What supplements would you recommend for people with PSA, psoriatic arthritis? Keith?
Oh, I get the easy ones, huh? So psoriatic arthritis is, again, that is often an autoimmune disease. Yeah. So that starts digestively. A lot of people have looked at psoriasis and things like eczema, and there often is a bacterial overgrowth and fungal overgrowth component. So really looking at the gut bacteria is really a key first step for diagnosis. In addition, when we looked at autoimmune disease, there is a correlation with insulin resistance. Oftentimes you will see people have blood sugar issues. And again, remember, insulin is one of our key inflammatory markers that can also have an effect as well.
Amazing. And in every single case of psoriatic arthritis, it's been treated extremely well with diet. So remember, watch out for dairy, gluten, sugar, all of those things really flare up the PSA. Okay, I have borderline gestational diabetes and I'm now 6 months postpartum. My fasting blood sugar is still a bit high, between 90 and 110. Do you think it's hormonal? Absolutely. Absolutely, it's hormonal. And it's important for you to get the test done that Keith was talking about earlier so that we can measure and see what you were before and how we can treat that. That is a long answer for this.
Right. And also remember, people forget gestational diabetes really increases your risk for prediabetes and diabetes. We forget that has to really be evaluated over time.
Okay. Ashwagandha for stress, 100%. I like theanine with ashwagandha, very good. Also maca, add some magnesium for that as well for stress, and some B vitamins, and particularly if you have methylation issues, which we know 30 to 40% of people have these, what we call methylation defects, where you can't absorb certain folate. Okay. Should we answer a couple more? Because we're kind of running out of time.
Sure. I can.
Okay.
No problem.
Hi, could you please advise on getting rid of acne in your late 20s and tips for clearer skin? Whew. How much time?
That's definitely yours.
So acne is very interesting. That you have to think of it, everything as connected. So your hormones are connected to your digestion. So we want to find out who's living in your gut. We looked at research and we found that if you have an overgrowth of bad bacteria living in your gut, those guys can go on to create bacteria changes in your skin. So we want to be able to do things like use oregano oil. We want to use probiotics. You want to be using things like mangosteen, anything kind of fermented on the skin to manage the skin microbiome. B complex, like B12, B5, B6, all the B vitamins, super important in metabolizing the dirty hormones. Milk thistle, I also find super helpful because we know part of the issue with the liver at getting rid of dirty hormones will help the skin. And then vitamin A, C, E, and zinc. Super important for getting clearer skin and keeping acne under control. Although, remember, everybody with acne is unique. And so I always treat people in a unique way. Try to, Shafna, go to my book, Reverse the Signs of Aging, and try the 4-week plan and let me know, send me a message how it's going when you're in week 2 so I can support you. Gosh, let's see. We'll answer one more. Keith, you take this one. Do you recommend omega-3?
Oh my God. Pretty specific question.
Thanks, Maria.
So, I mean, again, it's you got to think about for what reason. So I actually have my favorite study about omega-3. There was a study done that showed countries with low omega-3 levels had higher prison populations. So it actually has been shown.
So would that be the United States of America?
We're number one, actually, with the lowest omega-3.
We're number one. Okay, yeah.
But from mental health to absorption to immunity, omega-3 really is critical. But again, when you think of omega-3, you really have to break it down further and look at EPA and DHA and see what you're treating and what you need, because different disorders require higher levels of EPA than DHA. Like, for example, pregnancy, we focus a lot on DHA. As people get older, for mental acuity, we focus sometimes more on EPA. So you have to look at that.
And remember, your brain is made up of fat. So if somebody calls you fathead, it's actually a compliment. And we need fat to keep our brains running. And Dante, he's just come to say hi. He's on omega-3s. He's on omegas. And, you know, it really helps him with his coat and his fur. I just rescued him 2 months ago. And his fur is looking like really good now. And he's quite happy, as you can see.
and again, brain function, again, I would consider the most important of any of the functions. So that's really critical based on fats, and omega-3 being one of the big ones. And there was some studies done before where we showed that we consume so much omega-6s, and that actually can be pro-inflammatory, whereas omega-3 has the anti-inflammatory effect.
And really some amazing studies on depression and omega-3s. So right now, you know, if you've ever, anyone I test for omega-3s, most of them are low. It's insane. So this has been super fun. Join us next Wednesday. I don't know what we're going to talk about next Wednesday, but can you leave us some comments and let us know what you want us to talk about? And this has been super fun, Keith, as always.
Thank you so much for having me, and thank you for picking my favorite topic.
Yes, well, you picked, exactly, and you did all the groundwork here, so thank you so much.
Have a nice day.
We'll see you next Wednesday, everyone. Happy
Bye,
Wellness
thank
Wednesday.
you, and be safe.
You too. Bye-bye.